What are the treatment options for a prostate abscess? When it comes to treating a prostate abscess, understanding the options available is crucial. A prostate abscess is a localized infection that can occur in the prostate gland, often resulting from bacteria. The treatment typically involves a combination of antibiotic therapy and drainage of the abscess to remove pus and resolve the infection. The specific approach can vary based on the size of the abscess and the patient's overall health. First and foremost, antibiotic therapy is a key component of treatment. Broad-spectrum intravenous antibiotics are usually the foundation, often continued for 4 to 6 weeks depending on how the patient responds. Common antibiotics include fluoroquinolones like ciprofloxacin, trimethoprim sulfamethoxazole, third-generation cephalosporins, carbapenems, or piperacillin tazobactam. The choice of antibiotic may depend on bacterial culture and sensitivity results. For very small abscesses, typically less than 1 to 2 centimeters in diameter, antibiotics alone might be sufficient. However, if the abscess is larger or if antibiotic therapy does not resolve the issue, drainage becomes necessary. There are several methods for draining a prostate abscess. One common method is percutaneous drainage, which is minimally invasive. In this approach, a needle or catheter is inserted through the perineum, the area between the scrotum and anus, often guided by ultrasound or computed tomography. This method is usually the first choice due to its effectiveness and lower risk. If percutaneous drainage is not successful, or if the abscess is large and multiloculated, transurethral drainage may be considered. This involves an endoscopic procedure through the urethra to open and drain the abscess cavity. In rare cases, open surgical drainage may be necessary, especially for extensive abscesses that have spread beyond the prostate. This involves making a perineal incision to drain the abscess. For very small abscesses, which are less than 1 centimeter, conservative management with antibiotics alone may be effective. However, close monitoring is essential to ensure that the condition does not worsen. Supportive care is also important. Patients may need hospitalization for intravenous antibiotics, pain management, and monitoring of urinary function. Imaging studies, such as transrectal ultrasound or computed tomography scans, can help in diagnosing and planning treatment. It is essential to distinguish a prostate abscess from other prostate conditions, as abscesses can complicate underlying issues. Prompt and appropriate treatment is vital to minimize the risk of complications, such as sepsis or chronic prostatitis, which can affect overall prostate health. All treatment decisions should be personalized and guided by a urologist or infectious disease specialist, taking into account individual factors and health conditions. Early diagnosis and a combination of antibiotic and drainage therapy remains the standard of care for managing prostate abscesses. Always consult a healthcare professional for personalized medical advice.